My name is Oyeyiga Cicilia. I came purposely to Evercare after visiting many other places in relation to my knee challenges. It was concluded everywhere that I need a knee replacement. So I think that if I have to put down my knee for anybody, it must be a place that I have confidence in. So after being to many other places, I decided I'll come down to Evercare. When I started visiting, I first met Dr. Ojodu. Thereafter, I met Dr. Abilach, who eventually took up my case. And the manner of confidence he gave me, even with the fear I was exercising, was so much enormous that I know that, okay, I think this thing is going to come out well. Because I've had people who have had knee replacement elsewhere, and they tell me the experiences they had had, the painful experiences and the rest. So that fear was there. Nevertheless, I still want to go on with this knee replacement. And so by the time he spoke with me, and how the process will go, he said, don't worry, madam, I'll put you back on your feet. So much confidence and emotional confidence, I think so. So I decided, okay, let me make up my mind and go ahead. And that was how we started. So, and one other thing is that when I decided to have the surgery, it's not just the surgery that I have to confess. Every other part of the body system have to be tested and to know whether you have some other challenges in your body that might affect the result of the. So you have to tell them the history, your medical history, which I did. And then Dr. Abilach asked me to go ahead to do some other tests, like I'm an ulcer patient. I have to go for all those tests relating to gastritis. So it was after result was out that they had confidence that no, it will not affect the results, the success of the surgery. And so I have to do some plus and minus concerning my other parts of the body before it was eventually agreed that I'm in the right position to go for the surgery. And for the surgery, I came a day before the surgery. I was admitted, a very comfortable environment. And then we have the nurses and they are attending to you one after the other. So on admission, and then the next morning, Dr. Abilach was with me. He told me that they have like 4 that day. And that as a young boy, like 5 years old, who will go through his own phase, being a young person, might not be able to endure hunger and the rest, and that I'll be number 2 because he has put me there first. And so I was the second patient for that day. They had 4 that day. And I might not know this some medical terms, but I know that I was paralyzed from here down. And then the other parts of the body was conscious. And then, although my view was blocked, but I know what was going on around me, the talking, the doing, and the darts. So I was conscious of it, but this place, it was paralyzed. We don't feel anything until probably after and they have a very superb ICU. So despite the fact that I'm also a patient, that I wanted to develop some this and that here and there, they were able to make me stable. And you just have to talk, because once you talk, they know what is wrong with you. They are there with you. The ICU is superb, very, 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 very superb. Because before you do this, they know what is wrong and they attend to you. So I was in the ICU after coming out of the theater till the next day. By the time the doctor saw me the next day, he knew I can go down to my ward. And so I've been at the ward, and from there, like I had the operation on Monday. Today's Thursday. I'm at the physiotherapy. The second day, the physiotherapists have started visiting. It was just a minor exercise that was done. Then yesterday too, they were at my ward. Today I have to come down to their office, and all this thing that you see around me is happening. I just want to tell you that traveling, if you don't have the money to travel, this is another traveling for you. I never knew my leg could come back as beautiful, even looking more beautiful than the second one. Although I'm still trying to recuperate too. I am not totally completely on my feet, but it's looking, looking at it, you will know, looking more beautiful than the other one. But there's no one, even if the ordinary blade cuts your hand, you will feel pain or some sort of swelling. So it's just a matter of time. And then the physiotherapy is something, when you start, it might be a bit painful, but as you are graduating, it becomes better. I don't know whether you have to travel out. If you just need your people around you here, and you don't have to pay for people to go out with you there and be around you, this is just another home for you.